My name is Kyle and I'm a fourth year nursing student, and today I'm going to be talking to you about the handihaler. So the handihaler is a dried powder inhaler. It is a refillable device, so you just put your little capsule in there. It is breath activated, so you just need to take a breath. And this device is generally used for COPD patients when they are taking their long-acting bronchodilator, and they generally need to take 2 breaths to get the full dosage. And the reason for that is just because their body mechanics don't work as well as someone with normal lungs. So they need to take the 2 breaths to get the particles all the way down to the basis into the little airways of their lungs. And we open that up, we have this metal screen here, and that screen is to prevent the actual gelatin piece, part of the capsule, from coming up and through and the patient inhaling the gelatin. And these 2 parts here are the air intake ports, and this is the capsule holding chamber. And if we open that up, it comes through those air intake ports, and then goes up through the bottom here and then up through this little hole, and that'll just raise the capsule and cause it to vibrate and allow the particles to leave the capsule. And then these little pin-sized holes are also air intake ports. And this little green button here, that's the puncture button, so where you puncture the capsule. And one thing I would like to note about the puncturing is you don't want to puncture it more than once, because when you puncture it more than once, you take the risk of shattering the capsule and having the gelatin particles be inspired, so you don't want that. And so prepping this device before taking a dose, you want to make sure your hands are clean. So you wash your hands and you dry them really well. And so then you take the dust cap off. You just want to have a look to see if there's any particulate or anything that will impede the dose from being inspired. So just making sure it's nice and clear. And next you're going to want to look at your medication. So this is just a placebo drug. You just want to look at the expiration date, make sure it's not expired. And the one thing I'd like to note about the medication is it's very heat and environment sensitive. So it's sensitive to just light and temperatures. You don't want to freeze it either, because then you take the risk of the capsule shattering, which you don't want. So with this package, they have stop lines along the casing, and so to get a dose, you want to place your non-dominant hand, which for me it's my left hand, along the stop line, and you just want to slowly peel back until you can see one capsule. And when you see the one capsule, just pop it out. And you put it into the holding chamber. And then you snap that on. And now you're going to want to pierce it. So pierce it once. And now you're going to want to think about body mechanics. Okay, so when you exhale, you want to exhale away from the device, and then when you inhale, you want to do a chin tilt to have a more direct entry into your airways. And then you want to, turning away from the device, you want to breathe out of your nose to create positive pressure. And you're going to want to hear when inspiring, you're going to want to hear a rattling sound. So that rattling sound is a good thing because you know that the capsule is freely vibrating in there, and then that the particles are coming out of the capsule. And one particular note about the particulate is that it does contain lactulose. So if someone is lactose intolerant, it's something to consider. And so to just go through the steps again, I'm going to do it without saying anything, and see if you can follow. All right. I should have done that. Oh.
Okay, just continue.
Or is it still going?
Yeah, I'll just take this part out.
Okay. So exhaling away from the device. You're going to want to exhale away from the device because you're going to want to prevent any air getting into the device, because that'll cause humidity to build up in the device, and that'll compromise the medication. And the reason why it compromises the medication is because those particles will enlarge and then they won't get into your tiny airways. So you're going to breathe away, and then you're going to inhale, and while you're inhaling you're going to want to utilize a chin tilt. And so the chin tilt is going to allow the particles a direct pathway for the particles to get deep inside to your airways. And when you inspire, you're going to want to hold for 10 seconds utilizing the finger count, because if we don't utilize the finger count, a lot of times we'll count too quickly, and we want to hold for 10 seconds to allow that medication to get deep into the basis and into our little airways. Okay, and when you expire, you're going to want to expire away from the device, again because of the humidity, and you're going to want to go through your nose, because by exhaling through your nose, that creates a positive pressure. And what that means is those particles are going to move even deeper into your airways. And now I'm just going to go through the steps with the device, but I'm not going to say anything. All right. So you're going to want, well, first off, before I go into that, you're going to want to make sure that you're in a nice tall position, and that your chin is parallel with the floor, and that you're looking straight ahead. Okay, so here we go. And now you're going to want to take a second dose, and so you're going to want to do that same process twice, just because this is specifically used for COPD patients, like mentioned before. And when that second dose is completed, you're going to want to remember to take the capsule out. All right, so now if the capsule in here, if you don't hear the rattling sound and you want to, and you're wondering whether if it worked or not, it did not work. So what you're going to want to do is just tap the bottom of the base on the counter just a couple times. See, you can open it up to check if anything's blocking, and then try again. And it's only good for, and like I said before, because of the body mechanics, you're going to want to take 2 inhalations. So you're going to want to do that process 2 times, and just making sure that you're not breathing in the device to get any humidity in it. Now, so the last thing I'd like to talk about is just cleaning the device. Now, the device needs to be cleaned at least once a month. And to clean the device, you're going to want to get warm water with no soap, because you don't want the soap getting into the filter screen at all. That'll compromise the effectiveness of it. So what you're going to do is you're going to swish it in warm water, and then you're going to leave it on the counter or on a towel overnight. That's it.